Healthy sleep is essential for healthy child development. Both the American Academy of Pediatrics as well as the Healthy People 2030 initiatives have made statements recognizing that poor sleep is a critical public health concern. We know from research studies that over half of American children are not getting enough sleep per night, and that sleep quality is just as important as sleep duration. We also know that up to 1 in 5 young children and up to 1 in 10 school-age children and adolescents have sleep problems like difficulty falling asleep or staying asleep. Today in this video, I'll be answering some questions about sleep and share findings from a new study that my collaborators and I conducted looking at sleep problems over time and how they impact child well-being as well as what we can do about it. I suspect that many adults are familiar with the feeling they have after waking up from a really poor night of sleep. It can be difficult to concentrate, you may have a hard time getting things at work or at home done, and you may also feel more irritable. Now imagine that feeling for a child, especially a child that's growing, developing, and having to learn new things in school. When children don't get enough sleep or are having sleep problems, they have these same kinds of difficulties with attention, regulating emotion, getting along with others in the classroom. So we know that when children don't get enough sleep or when children have sleep problems, they have a really hard time functioning the next day. Over years, that can kind of accumulate so that children may have even greater problems when they have sleep problems over a long period of time. With my colleague, Dr. Jody Mandel at the CHOP Sleep Center, we looked at data that researchers had collected using a cohort of children that they followed in Australia from birth to ages 10 to 11 years, and the children were assessed every 2 years. We wanted to look at these research data to understand whether children followed different patterns of sleep problems over time, such as children who maybe had no sleep problems or persistent sleep problems, meaning problems at every age. What we found was that children did have sleep problems that persisted over time. With one group of children, we found that those that had problems from birth all the way to age 10 to 11 years were also those more likely to show poor child functioning outcomes when they hit middle childhood. These outcomes included quality of life, so having worse quality of life, as well as worse teacher-rated academic functioning, and that means things like inattention in the classroom and difficulty with organization. And these children with persistent sleep problems also showed the poorest mental health, meaning more symptoms of anxiety or low mood compared to children with no sleep problems. And this was according to both teacher reports as well as what parents said. We found another group of children over this time period as well. These children showed no sleep problems early on in development, but around 4 to 5 years of age, they showed sleep problems that were increasing all the way through ages 10 to 11 years. These children, like those with persistent sleep problems, also showed poor psychosocial outcomes, those same mental health and quality of life outcomes that I mentioned for the persistent sleep problems group. We also found another group of children, those children that had sleep problems only in early childhood, so a pattern of problems that were the highest from 0 to 5 years of age and then seemed to be resolved, as well as children who followed a group showing the lowest level of sleep problems over time, also had impairments in their psychosocial outcomes compared to children with no sleep problems. The bottom line, sleep problems at any age are linked to impairments in child well-being later on in middle childhood. When thinking about these results, it's really important to keep in mind that just because a child has a sleep problem does not mean they're destined to have poor mental health outcomes. At the same time, it's also important to keep in mind that in the study we did, we couldn't tell whether, for example, children who had early difficulties, such as with anxiety or mood or inattention, also showed sleep problems because maybe there were bidirectional links. This means that the anxiety, mood, or inattention could have impacted sleep, which then also could have impacted subsequent psychosocial functioning outcomes. Our findings support consistently integrating questions about sleep into routine developmental screenings and at child well visits in the doctor's office or even screenings at school. Ultimately, we want sleep to be assessed as a vital sign in preventive visits, along with items like child height or weight. Identifying sleep problems early can help parents and providers begin to address early sleep problems, so hopefully they don't persist longer over time. I'm excited to be collaborating with the CHOP Primary Care Network and with the Possibilities Project to pilot evidence-based sleep screening questions into routine well-child visits across the network. With funding from the Eunice Kennedy Shriver National Institute of Child Health and Human Development, I'm also leading a study looking at the effects of Sleep Well, which is an evidence-based child sleep program adapted for toddlers and preschoolers presenting to CHOP primary care sites with behavioral sleep problems. These projects are part of my larger research focus, which is to try to reduce sleep health disparities to promote positive child development.